I've started our recording for the day, and as we go forward, if you have questions for our speaker, you can enter them in chat. We will have some time for question and answers at the end. And part of this work today is now aligning with the Laudato Si goals and the UN Sustainable Development Goals, in which we have been asked to be part of a movement to care for creation and be part of a global effort for climate resiliency, and looking at the spirit of an integral ecology with hope for the poor and hope for the earth. So as we go forward today, just as a real opening to center ourselves and to listen with an open heart and an open mind, I'd like you to just remember some of what we've read through Laudato Si, and taking time to listen to the cry of the earth and the cry of the poor who suffer the most. And because I feel that there is a very strong vocational pull, both with our speaker and with our stakeholders and religious congregations that are joining us, starting with one's own vocational community and then reaching to every corner of the earth and every creature, as we experienced how everything is linked, everything is related, everything is connected. So with that, I would like to introduce you to Jessica Leclaire, and we'll enjoy our next hour together.
Thank you so much for that beautiful intro. And I'm going to share my screen here in just a second. Wow, I feel like I have so much to learn from all of you. And I can't wait for our discussion afterwards. I'm very inspired by the introduction. But hi, everyone. So just honored to be here with all of you. My name is Jessica Leclaire, and my pronouns are she, her, and I'm an instructor and PhD student with the University of Wisconsin-Madison School of Nursing. And I'm also affiliated in my work as a faculty member with the Nelson Institute for Environmental Studies and the Global Health Institute. And today I will provide an overview for you of environmental justice nursing for planetary health. I want to begin this presentation with an invitation to sit back for a moment and relax in our chairs. Close your eyes if you're like, or continue eating. I know it's lunchtime, but let's take a moment to just take a deep breath and feel our feet on the floor. We can imagine roots actually growing from the bottoms of our chairs or our feet directly into the earth. Know that we are all connected, as Beth just said. We're all connected with each other and with the earth. There is no separation. So feeling a sense of deep gratitude for each other and for the earth, the land, and the waters. And if it feels right, we can connect to the land that you are on right now. And speaking for myself, I also want to acknowledge the Ho-Chunk Nation, on whose lands I am grateful to work and live as a guest. And I deeply respect the knowledge that's embedded in the Ho-Chunk Nation's custodianship of Didjop, which was the original name for this land, and recognize their continuing connection to the land, water, and community here at the University of Wisconsin-Madison. I identify as a white, cis, hetero, able-bodied woman with colonial settler heritage. And so I aspire to lifelong reflective praxis so I can try to be an effective ally and a co-conspirator for social and environmental justice. And I apologize, sometimes my slides want to just go on their own before I actually click the next. So apologize for going back and forth a little bit here. So before we dive into planetary health and environmental justice, I do want to share a story about my own light bulb moment, if you will, about the intersection of environmental justice and planetary health. So we know that in Wisconsin, it's becoming warmer and wetter with more frequent and extreme weather events here. And some populations are closer to the front lines of these extreme weather events than others. And so I worked as a public health nurse for many years. And as public health nurses, we have relationships with people who experience this inequitable distribution of environmental hazards and the subsequent health inequities due to oppression from racism, from socioeconomic status and or immigration status and other social identities. And many of these social identities intersect. And so when we're experiencing oppression from multiple sources, we can become further weathered, if you will, less resilient in the face of public health emergencies like climate breakdown. And so in 2012, this feels like forever ago now, but I was working with a low-income neighborhood in Madison to address resident concerns about lack of healthy opportunities for youth. And this is one of our most diverse neighborhoods with residents of many different races and ethnicities and languages, frankly, just from all around the world. And at a neighborhood meeting, a local elementary school principal mentioned that children from this neighborhood were increasingly missing school because of increased asthma symptoms and other breathing problems over the last 3 years. And the families shared how their apartment buildings had not recovered from the flooding in 2008. And by 2012, now their basements were boarded up due to the mold that had also seeped into the vents. So every time it rained now, even a few inches, their basements and yards flooded because their apartment buildings were literally sinking into the ground. And many service providers, including myself, that were at the meeting wanted to take immediate action. But families asked that we please not call building inspection and please don't talk with their landlords and please don't bring our environmental health sanitarians into their homes because they very much feared eviction. Now, Madison has very few affordable housing options, and parents told us that they would rather stay in their unhealthy apartments than sleep in their cars. So rather than place the burden on this community that's on the front lines of climate change, I met with our stormwater engineer who shared that the water table in these neighborhoods is so high because of the lake levels. And the lake levels are controlled by the state DNR, whose hands were tied because lakefront property owners wanted to maintain their docks and their boats and their property values. And I was told that it was beyond the control of the city, and that was the end of the story at that time. But of course, the story is not over, right? This ongoing flooding concern was highlighted again in 2016. Residents were noticing the increased frequency of rainfall, storms, and flooding from the neighborhood creek that was pouring out onto their adjacent streets, creeping up their lawns and flooding their basements. And a resident actually shared video footage with me of children playing in the floodwaters, which we can assume contains sewage bacteria and mold. And this particular creek is also known to carry agricultural chemicals. And this issue is, of course, only getting worse. In August of 2018, across our entire state, right, we experienced terrible storms and flooding. We had 9 to 15 inches in Dane County alone, which resulted in 1 death. So residents all along our isthmus experienced continued terrible flooding, and they started sandbagging their homes. Oh, there we go. I'm not done with my story. And now that this climate emergency has spread beyond the most marginalized populations, it's getting some attention. And so conversations are starting to happen now at the local and the state levels. However, this remains, a very complicated issue. And I began to wonder if nurses had been empowered to address the health effects of climate change 10 years ago, would the health of our neighborhoods be improved today? And what would that mean for broader governance and policymaking? And these questions just started to keep me up at night. So here I am to educate and empower our future nursing workforce, because I found that for climate and health to be integrated into governance and policymaking, we actually have to start including it in our education systems, and especially in all health professional schools globally. And so these environmental justice and planetary health issues are not going away. In fact, as I just explained, they're increasing in frequency and severity with more complicated health and social impacts. So since I joined UW-Madison in 2018, I learned about the planetary health movement, which, using my holistic nursing lens, is an incredibly strong framework to help focus my own teaching and research. And the current definition of planetary health that you see here focuses on the public health impacts of our global environmental crises and how humans are altering our natural world. And so planetary health encompasses the entire context for population health. And as a nurse, the more I understand the full picture of what is before me, the more clarity I have on what is needed to help with the healing processes. So thanks to this emerging science, this term has more recently penetrated mainstream academic and public health discourses. And we're pretty excited about it, about planetary health at UW-Madison, where our Global Health Institute launched its first Planetary Health Scholars Program for interdisciplinary graduate students in spring of 2020, which I've been honored to be a part of that as well through my PhD work. And because planetary health, again, is this emerging field and nascent in nursing research, I've also committed myself to conducting research on effective environmental justice nursing strategies that promote planetary health. So I'm actually entering my third year in the PhD nursing program. And again, my goal is for our future nursing workforce to feel empowered to address these often very complex issues. So let's take a deeper dive into understanding planetary health. While it has become a field of its own in recent years, the term planetary health, which, as I've said, denoting the interconnections between the health of person and place at all scales, actually emerged from the environmental and preventive health movements of the 1970s and 1980s. And it underscores how human health is intricately connected to the vitality of natural systems within the Earth's biosphere, and is seen as sort of this overarching connection or thread, if you will, among other prominent fields such as public health, eco-health, One Health, and global health. Sorry with my slides. It's also important to point out that the planetary health movement, which, as I said, began in the 1980s, was actually an extension of Indigenous knowledge and ideation. So scholars have underscored that Indigenous cultures have long since understood that human health and planetary health are the same thing, or to harm the earth is to harm the self. So it must be recognized that the foundations of the contemporary planetary health concept are a product of Indigenous science and medicine and long-standing awareness that human wellness is dependent upon the vitality of the natural environment. And this quote from Chief Seattle highlights this deep ecological knowledge. So let's explore the intersection of global public health and planetary health. So we know that humanity has made tremendous gains in global public health. By almost any measure, our global health is better now than at any time in history. Since the 1950s, our life expectancy has increased by more than 30 years, and death rates in children younger than 5 have decreased from about 20% of live births to about 6%. However, morbidity and mortality trends in humans are now inseparable from the declines in planetary health. The slow progress made towards major public health goals, such as eliminating health inequities, now is outpaced by a consumption-driven economy that is rapidly degrading land, air, and water systems worldwide. Planetary health assesses how global pollution, climate change, biodiversity loss, altered biogeochemical cycles, changes in land use and resource scarcity are decreasing the quality of the air that we breathe, the water we drink, the food that we grow, exposing us to new diseases like COVID-19, decreasing our access to fresh water and other natural systems, and increasing the incidence of natural disasters like the massive fires, heat waves, and hurricanes and flooding that we've been seeing. And all of this can have negative consequences for our nutrition, our mental health, and susceptibility to injury and disease. You know, people often focus on climate change as an entry into understanding planetary health, However, it's really important to keep in mind that it's only actually one vital sign of the planet. In the world of planetary health, climate change is viewed as one symptom of a multi-system failure, or if we're viewing the Earth as a living organism, as a multi-organ failure. So a landmark paper in 2015 defined the safe operating space, effectively launching the planetary health field for public health, as I mentioned earlier. So I know this is a bit of a confusing graphic, but it's so core and central to the field, I have to share it. So the green zone, and again, this was in 2015, was labeled the safe operating space. The yellow zone represents the zone of uncertainty or increasing risk, and the red is a high-risk zone. So the planetary boundary itself lies at the intersection of the green and the yellow zones. So the planetary boundaries framework identifies those biological and physical processes and systems that are important to the maintenance of the Earth's functions that all life relies on to grow and flourish, the safe operating space, right? So changes in these systems either manifest at the global or the regional scale, such as climate change, or at the local scale, such as biodiversity loss, but start to show such similar trends and effects or interactions that they add up to a global issue. So substantial changes in these systems could produce rapid, nonlinear, and potentially irreversible changes in the Earth's environment that would be disadvantageous, right, to human development and health. So the framework relates to 9 global or regional pressures facing the Earth's biophysical systems. The boundaries associated with climate change, biosphere integrity measured at present by the use of extinction rates, biogeochemical flows, which are measured by flows of nitrogen and phosphorus, and land system change, which is measured through the amount of remaining forests, are estimated to already be outside of the identified safe operating space. And again, that was back in 2015, and we know that things are rapidly declining since then as well. So planetary health looks at how our expanding population, our changes in technology, and patterns of consumption and production are fundamentally changing our land, our atmosphere, and our oceans, right? When you look at this graph right here, you can see that we're at the edge of a cliff. So whether we're looking at human appropriation of freshwater resources or the proliferation of motor vehicles, consumption of fertilizers, production of paper or plastics, or primary energy use, graphs showing the scale of human consumption all reveal a similar, nearly exponential pattern over the past several decades. So in summary, our environment is changing, and it's not just our climate. All of the symptoms of planetary sickness that you see here are inseparable, interconnected, as we discussed. And here's a summary of just some human health impacts that we're seeing. So when we're thinking about extreme heat health incomes, we're worried about how extreme temperatures are contributing directly to deaths from cardiovascular and respiratory diseases, particularly among people who are very young or very old. High temperatures also raise the levels of ozone and other pollutants in the air that exacerbate cardiovascular and respiratory disease. Pollens and other aeroallergen levels are also higher in extreme heat. These can trigger asthma, which affects around 300 million people globally. Ongoing temperature increases are expected to increase this burden. When we're looking at natural disasters or variable rainfall patterns, globally, the number of reported weather-related natural disasters has more than tripled since the 1960s. Every year, these disasters result in over 60,000 deaths, mainly in the developing countries. We've all heard about rising sea levels will result in further material damage, thinking about housing, health facilities, et cetera. More than half of the world's population lives within 60 kilometers of the sea. People may be forced to move. We were talking about this just before we started earlier, otherwise known as displacement or climate refugees, right? Which in turn heightens the risk of a range of health effects from mental disorders to communicable diseases. And increasingly, variable rainfall patterns are likely to affect the supply of fresh water. So with this, increases of drought and famine, as well as compromising hygiene, resulting in diarrheal disease. I discussed the impacts of flooding. These rising temperatures and variable precipitation patterns are likely to decrease the production of staple foods in many of our poorest regions. So this will increase the prevalence of malnutrition and undernutrition, which currently cause about 3.1 million deaths a year. And thinking about patterns of infections, climatic conditions strongly affect waterborne diseases and diseases transmitted through insects, snails, or other cold-blooded animals. And this is the warning from the 2019 Executive Summary of the Lancet Countdown. The life of every child born today will be profoundly affected by climate change, with populations around the world increasingly facing extremes of weather, food and water insecurity, changing patterns of infectious disease, and a less certain future. Without accelerated intervention, this new era will come to define the health of people at every stage of their lives. And this is one of my favorite pictures of my youngest son. So as a mother, this quote really hits home. And the same commission report that established the field of planetary health in 2015 stated this, that we have mortgaged the health of future generations to realize the economic and development gains of the present. So that's a lot, I know. And there are endless things that we can do together to lead us towards a great and just transition. You will find that much of the mainstream discourse is behavior focused or individual behavior focused, right? Which isn't bad, it's desperately needed, but it doesn't get to the actual root causes driving planetary health crises. And we'll get to that throughout the course of this presentation. Much of the current discourse revolves around how we can maintain, yet also change the way that we live our lives, right? For example, if we change how we travel to that of active transportation, which is walking or biking, and clean transit or mass transit options, we know this can lead to decreases in morbidity and premature death, increases in social cohesion or connectedness, decrease our transportation costs, increase access to essential services. We know that if we're eating less meat and advocating for less food waste and sustainably produced food, this can lead to increased food security, decreases in morbidity, antibiotic resistance, pesticide exposure, and water contamination. And if we're advocating for urban greening and green infrastructure, we know that this can lead to decreases in heat illness, flood risk, air pollution, increases in physical activity, social cohesion again, water capture filtration, carbon capture, and healthy foods. And one of the most important recommendations, and I hear this coming from you and what Beth said earlier, comes from, again, also Indigenous scholarship. It's changing the stories that we're telling ourselves about the illusion of separateness from each other, from other species, and from the earth itself. Again, we're all truly connected, and if we would all be healthier, right? If we acted under that paradigm shift. So this is another way to analyze the paradigm shift. This model shows how humans, populations, and ecosystems are interconnected, and health can be assessed at every level. So the planetary health lens assesses planetary boundaries, right? Or those limits for how much our planet can take to maintain our survival. And this translates directly down to human health status and social well-being. But human health and social well-being can also reverberate outward and improve the health of our planet because we are all interconnected. So health professionals and other disciplines are also internationally organizing around these issues through the formation of the Planetary Health Alliance. And I will share more info on this and ways to engage in a bit later. So how does justice intersect with planetary health? The fact is that it is central to planetary health. Environmental and health impacts of a changing planet are not distributed fairly across populations, species, geographies, and generations. For example, while the world's high and upper middle income countries are responsible for the vast majority of carbon emissions, the burdens of climate change are disproportionately felt by frontline populations, including low-income countries, people around the world, island nations, indigenous peoples, young and future generations. Equity in planetary health incorporates the rights of humans and the rights of nature, giving all human populations and ecosystems, present and future, the opportunity to attain their full vitality. The structural inequities and root causes of planetary health crises include historical and political injustices, hundreds of years in the making, including settler colonialism, white supremacy, racism, patriarchy, capitalism, and neoliberalism have contributed to the disenfranchisement of populations, including through the degradation of our environment that prevents this planetary vitality. So in working towards justice, inclusion, diversity, and equity, planetary health professionals must commit to imagining bold alternatives and implementing practices that address the root causes of injustice within and between societies. Affected groups, including indigenous peoples, continue to demonstrate resilience to large-scale environmental and social changes resulting from ongoing colonial processes. People who are working to restore planetary health can learn from impacted people by prioritizing their wealth of knowledge for potential actions. So environmental justice brings to current public and planetary health discourse an unblinking critical approach to the root causes of population health outcomes, beyond the social determinants of personal health, to the global patterns of domination and violence that is impacting all life. And while Black feminist voices have largely been marginalized for mainstream environmental discourse, their work exists. Black feminist environmental justice thought leaders, advocates, and organizers, such as Leah Thomas, who you see here, have created and defined theories of intersectional environmentalism. And she defines intersectional environmentalism as the following, and I'll quote, "This is an inclusive version of environmentalism that advocates for both the protection of people and the planet. It identifies the ways in which injustices happening to marginalized communities and to the earth are interconnected. It brings injustices done to the most vulnerable communities and the earth to the forefront and does not minimize or silence social inequity. Intersectional environmentalism advocates for justice for people and the planet." So this theoretical lens is front and center of the environmental justice movement. The climate crisis is at the forefront of the environmental justice movement and viewed as an international environmental justice issue, also known as climate justice. So climate justice recognizes climate change as a human and civil rights issue, and one that is completely entangled with colonialism, white supremacy, patriarchy, human supremacy, and capitalism. So working to slow down the damage to our planet is a net gain with the health and the social justice lens. Promoting health and racial equity should be central, again, components of strategies designed to combat the health effects of environmental degradation. In practice, it requires ensuring the fair treatment and inclusiveness of historically marginalized people who are most affected when creating policies and practices that address planetary health symptoms like climate change. So who are at the front lines of the environmental justice movement for planetary health, and who is most affected by environmental and climate injustices? So as I've been saying, white supremacy, which is reinforced by capitalism, provides an exemplar of a pattern of domination that's expressed through environmental racism. And environmental racism refers to any policy, practice, or directive that differentially impacts or disadvantages, whether intended or unintended, individuals, groups, or communities based on their race or color. And environmental racism has impacted Black, Indigenous, and other people of color for centuries through the practices of slavery, genocide, and colonization. And as a result, today, environmental racism presents as people living in substandard housing, people living in close proximity to pollution sources, people who are employed in more dangerous occupations, people who are having less access to healthy food, and those are just a few examples. And so again, thinking through these frontline populations, and within every population, there are extremely physically vulnerable people, such as, again, the very young, the very old, people who have chronic health conditions, people who are taking certain medications, and so on. So again, the solutions for combating this public health emergency are right in front of us. We know that working to slow down the damage to our climate and other planetary health boundaries is a net gain with the health and the social justice lenses. So if we want to protect our health during this climate emergency, then we must actively work to dismantle racist systems of oppression and white supremacy. So across the nation, the Health Voice is in partnership with frontline communities and environmental justice advocates for planetary health. For example, listed here are just a few of the many organizations that you can explore who are collaborating to amplify the connection between social justice, health, and environmental degradation. And so we have endless opportunities to support the efforts of frontline communities who are and who always have been taking action. So what's the role of health professionals in the planetary health movement? And when introducing planetary health to health professionals, it's often helpful to start with climate change, as it's one vital sign of the planet that has, as I said before, surpassed that safe operating space in the planetary health boundary framework. So we'll dive a little bit deeper into this. So how are health professionals engaging with the climate movement? We know that in 2018, the United Nations Intergovernmental Panel on Climate Change stated that we have at most until 2030 to significantly decrease our carbon output if we want to avoid complete catastrophe. And as a result, many health organizations, including the Nursing Collaborative on Climate Change and Health that you see here, have banded together to commit to climate action to accomplish these goals. In 2018, we thought we had about a decade to fundamentally transform our economy away from fossil fuels to avoid the threat for all of us. We didn't know, obviously, that this existential threat would come upon us so soon, right? With such ferocity, and made us realize the essential interconnectedness, again, of everyone on this planet. It has always connected us to this profound fragility we face, and the critical connections between these existential threats and COVID-19 and the climate crisis all have common root causes and solutions. And so I just think this fear of pandemics needs to be linked to the deforestation that happened to cause it, and to capitalism and climate change. That might help us overcome this inertia in working towards a restoration of planetary health. So here are some of the priorities of the Nursing Collaborative on Climate and Health that you see here. So obviously, elevating climate change is a visible priority, supporting the development of climate literate nurses, building collective support and actions, and engaging nurses, communities, and policymakers in all of these things. So I'll now provide just a quick exemplar of how we're working to build climate literate nurses at our School of Nursing. So I introduced planetary health nursing in a required class for the traditional BSN, or Bachelor of Nursing Science students, called Social Justice in Local and Global Settings. So these are just a couple images from our website to hopefully give you an idea of what active learning looks like at our school when we're not in the midst of a pandemic, right? So we feel very fortunate to have these very large spaces to effectively engage very large groups of students. And our School of Nursing moved away from solely lecture-based classrooms to more of an active learning approach. So I actually provide a lot of background readings and resources for the students about planetary health and climate justice, and the role of nurses then to prepare for our in-class activity. I also just want to quickly say that we adopted a concept-based curriculum. So I understand that some of you are nurses, so I just want to explain how we're teaching it now at our school. It's an approach that moves away from subject-specific content and instead emphasizes these really big ideas that span multiple subject areas. So then we tie in exemplars to demonstrate how the concept can be applied to multiple issues. So for this class, our concept of the day was the social ecological model, which is a model for looking at strategies at the individual, family, community, systems, and policy levels. And the exemplar was all about planetary health and climate justice. So in essence, we're using the social ecological model as an approach to understand and implement the nursing strategies that address the human health effects of our planetary health problems and promote solutions. So this is a slightly blurry image, I'm sorry, of the social ecological model from a text that I give to the students. Again, there's just endless opportunities to individually and collectively advocate for change at the individual, community, systems, and policy levels. My frustration with what I have seen in practice as a nurse has propelled me forward through the full spectrum of advocacy. And these days, I kind of like to hang out the top 4 layers that you see here, going back and forth between the organizational levels, professional and education standards, community work, and socio-political advocacy. So I shared at the beginning that I felt incredibly alone and disempowered a few years ago, and my path forward was reaching out and finding nurses around the nation and internationally who were struggling in the same way. And we banded together in many different ways to create movements for change. And this is what inspired me to move into academia, as I said, to empower future generations of nurses so that they never have to go through what I did. And I share with them a few organizations to help support their work. So the first one that really helped me enormously is the Alliance of Nurses for Healthy Environments, which is the only national, and they're moving into international now, environmental organization for nurses. And they're a national nonprofit nursing organization with a mission of promoting healthy people and healthy environments by educating and leading the nursing profession, advancing research, incorporating evidence-based practice, and influencing policy. And the Nurses Climate Challenge is the first attempt at launching a national, and now moving also into international, movement that just revolves around nurses educating their healthcare colleagues on the health impacts of climate change. So this challenge involves recruiting nurse climate champions who will then all have access to a set of online resources created by Healthcare Without Harm and the Alliance of Nurses for Healthy Environment. And Healthcare Without Harm is an international nonprofit with a mission of transforming healthcare worldwide so that it reduces its environmental footprint and becomes a community anchor, if you will, for sustainability and a leader in the global movement for environmental health. So I also share this spectrum of advocacy slide with my students and discuss the many ways that individuals can work together for collective action. I mentioned a bunch of them previously. This is a picture of myself meeting with Senator Tammy Baldwin's staff to educate them on the health effects of climate change that we're seeing in Wisconsin. And on the far left there in the purple is Kara Cook, who is the programs manager for the Alliance of Nurses for Healthy Environments. So I also want to share about Nurses Drawdown. So nurses around the globe are invited to participate in Nurses Drawdown. Since the earliest days of professional nursing, we have understood that optimum health requires good nutrition, adequate mobility, and a healthy environment and social support. So through committing to nursing drawdown actions, nurses will improve the health of individuals and communities while also taking steps to heal the planet. So in partnership with Project Drawdown, nurses from all specialties and in all practice settings are encouraged to take action in these key areas that you see here. The Clinicians for Planetary Health initiative is a global effort to galvanize health professionals, patients, and communities around planetary health through lifestyle modifications and activism. So their approach right now is working to develop outreach materials for healthcare settings internationally that encourage individual and community level planetary health actions with an emphasis on health and environmental co-benefits. They convene periodic calls to brainstorm, network, and exchange resources to build this commitment to planetary health across the entire healthcare sector. And it's again part of the Planetary Health Alliance, which is a consortium actually of over 240 universities, non-governmental organizations, research institutes, and government entities from all around the world, committed to understanding and addressing global environmental change and its health impacts. And I'd be remiss if I didn't share a few Wisconsin's specific resources for those of us in Wisconsin. Many states have things that are similar to this. Our Wisconsin Public Health Association has a climate and health section that's been active since, I believe, about 2013 to influence public health policy related to climate change. We also have a newly formed Wisconsin Health Professionals for Climate Action that also addresses climate-specific health policy in Wisconsin. We also have a Wisconsin Environmental Health Nurses Coalition which grew out of our local Wisconsin Nurses Association, but then developed into a broader coalition so that nurses that maybe weren't members or other disciplines that weren't members of the Wisconsin Nurses Association could also engage in this. And then we also have a Wisconsin Environmental Health Network, which is connected to Physicians for Social Responsibility. Okay, so I hear some of you thinking this is all great, but what about environmental justice strategies specifically, if those are central to our work in restoring planetary health? And I hear you. I didn't see that being addressed very clearly either by health professionals. So I did a review of the literature in 2019 during my first year in the PhD program. I scanned the literature, the nursing specific literature back to 1980. Again, when the environmental justice and planetary health movements first started. And this is actually the very first scoping review in the literature to explore environmental justice nursing strategies. So while climate justice is a concept tied to planetary health and it's at the forefront of the international environmental justice movement, it remains fairly nascent in nursing with ample opportunities to build leadership and momentum. So environmental justice appears to be a growing movement as well in nursing with an urgency for furthering knowledge. And I found 24 articles with studies describing nursing research projects over the past few decades. And this table that you see here provides a summary of strategies that were described in those research projects. Many of the papers use qualitative and community engaged methods, including community-based participatory research and participatory action research. Through the implementation of these participatory strategies, they found that community members were deeply engaged in the project designs and the data collection, and interdisciplinary research and communication were also noted to be necessary for providing a comprehensive basis for environmental justice research. Some articles focused on environmental justice education strategies with community members, some studied nursing education, some studied effective advocacy strategies, like the research strategy of participatory engagement. Environmental justice nursing practice strategies included individual and community engagement and cultural awareness. So many environmental justice assessment strategies used in practice were studied, where they demonstrated how to assess proximity to industry or other possible polluters by using environmental justice screening tools or using census data. The combination of citizen science and photo voice were shown to be really great complementary methods for community assessment. And then the nurse researchers uncovered the desire for individuals and families to discuss the information about their living space related to their perceptions of environmental safety and the related mental health concerns. And all the research studies stress the critical importance of nurses in practice settings being aware of the potential disparate risks for environmental exposure within marginalized populations. So I just want to quickly share a highlight from one of these studies as an example of community-based work being done by environmental justice nurses for planetary health. And in this article by Mary and Shao, the ideal situation is described where, because the nurse was already quite involved in the community through her service as one of the environmental task force committee members for the Alabama State Nurses Association, she actually received a direct request from a community member to assist with the environmental health issues, which were numerous, as you can see here from their signs, including being exposed to coal ash from living near coal-fired power plants and living near a landfill in the field sewer system. Their health issues included kidney disorders, asthma, cancer, and neuropathy. Drinking water samples also showed high lead levels. So when organizing around these issues, the community members maintained control over the project in partnership with the nurses. These nurses collaborated with them to provide a series of educational workshops that focused on health education and capacity building for advocacy. So as a result, community members communicated their own findings with elected officials, the health departments and the EPA, as well as many others. They also created a short documentary on their process and findings, which attracted national and international attention. The United Nations and the National Geographic both visited this area. And then the citizens initiated a free clinic, obtained funding to fix the sewer system, raised funds for faucet water filtration systems for families in the affected area. So while considering all the things that we can collectively accomplish, the Climate Justice Alliance reminds us how we must identify priorities for action that reshape institutions, such as laws, healthcare, education, that are reproducing these environmental inequities and influencing planetary living conditions. So understanding these systems of power can enable solutions that improve planetary health outcomes. Although interventions aimed at both the individual and household level behavior changes continue to gain prominence, and they are important, especially in public health, these individualistic focus can actually burden populations that are already impacted by inequities. And in fact, this approach can then result in a distraction from structural, political, and institutional responsibilities to promote planetary health. For example, we cannot mitigate climate change without holding accountable the 20 companies that are responsible for 1/3 of the worldwide carbon emissions. Further, we cannot promote food security without also holding accountable the agri-food industry, transnational corporations who govern and control the world food system. So in order to transform systems of injustice, large-scale power movements must continue to build momentum. To promote equity in planetary health, it's essential to prioritize, again, the needs of the most affected populations and ecosystems. This includes supporting resilience, strength-based approaches, the capacity to anticipate and mitigate risks, and a just transition. To accomplish this, professional practice within planetary health requires cultural humility and cultural safety, empathy, the promotion of inclusive and diverse participation in defining the problems and the solutions. And achieving justice and equity also requires a recognition of one's power, influence, biases, and resources, and a responsibility to use these privileges in working towards a healthier planet, while also raising up the inherent power of the less privileged. And all to say, only when we come together in community and solidarity will we enjoy collective co-liberation, health, and well-being. So I just want to end this presentation with an invitation to once again take a deep breath, sit back, relax in our chairs, close your eyes if you like, take a deep breath, feel your feet on the floor. Imagine those roots growing from the bottom of your feet or your chair into the earth. Know deeply that we are all connected with each other and with the earth. There is no separation. Feeling a deep sense of gratitude for each other and for the earth, the land, and the waters. Have faith in the healing power of nature, of people, of places, and the planet. And to ease us into the rest of our day, I want to share a short poem, if I can. It's called, and many of you probably know this poem, it's called The Peace of Wild Things by Wendell Berry. When despair for the world grows in me, and I wake in the night at the least sound, in fear of what my life and my children's lives may be, I go and lie down where the wood drake rests in his beauty on the water and the great heron feeds. I come into the peace of wild things who do not tax their lives with forethought of grief. I come into the presence of still water. I feel above me the day-blind stars waiting with their light. For a time, I rest in the grace of the world and am free. So may we all carry a little of this grace and peace with us throughout the day, and again, have faith in the power of healing and co-liberation through resilience, resistance, perseverance, and resurgence. Here are my references, and thanks so much for your close attention. I'll stop sharing so I can see all of you now.
Thank you, Jessica. Wow, that was a lot of information, and you are deep in the research, and that's tremendous. Thank you for your time today. Does anyone have any questions for Jessica? You can raise your hand and unmute yourself, or you can put it in chat and I can read it out loud for you. Sister Lucy Slinger, you're on, friend.
Yes, kudos on all the work you're doing. But as someone who has followed this a long time and taught sustainability, my question for you is, when is the medical profession going to get their act together and stop using all of the what use once and throw away? I mean, if we do not work with the next generations of medical care people, they are the #1 producers of toxic waste that gets burnt up. And they are the #1, AMA is the #1 cause of medicines in our water systems. Not because people are dumping them down the toilet, but because we are overprescribed to the point where we excrete so much of the medicines we take. And I know I'm being a gadfly here. I applaud you for what you're doing, but I have to say that the medical profession has been lagging in this area. And if they don't address local concerns, nothing's going to change. And it's so easy to justify one-time use equipment and materials and say it's the only way. And yet we have hundreds of years of examples where that wasn't the required way to do it. We go with what's simplest and most convenient and justify it. And we do that in our personal lives. And if we don't address that, I don't know how we're really going to have significant changes. We can talk all we want about social justice. And it's not hitting home. To just deal with the social justice in terms of how you're interacting with patients from different social economic stratuses or cultures is not dealing directly and significantly with what sustainable nursing is about. I just am bringing that up because all the time I taught at Viterbo with the nursing students in my sustainability classes, and this goes back 20 years. I mean, I can tell you a number of them would ask, well, I just would say, why don't you think about environmental nursing? And I don't even know if they're doing anything at Viterbo anymore, but I do know that there were a good number of students that had a high interest in learning how to do it differently. But then they go back to the nursing professionals and the regs that are in hospitals. I mean, we don't need to work on the national level. We need to work on the local employed level for really getting change to happen. And that's enough of my preaching. I'll get off the soapbox. But thank you for doing the work you're doing. I just want to see a few things change for the better in the whole healthcare, because right now it is so out of control economically and in terms of how it's done, that there's no sustainability associated with it.
Thank you for that. I really appreciate your perspective. And I will say that Viterbo is still going strong. There is, I know at least one clinical assistant professor that is doing a lot of education, baking it into the curriculum. They're also moving to concept-based curriculum there. And so I've been talking with him about how to really bake this concept, all of the concepts you're talking about as well, throughout not just undergraduate, but also into now their DNP programs and so on. So yes, the Alliance of Nurses for Healthy Environments is also still in Viterbo, still going strong. And I also want to say that, yes, you bring up really important perspectives for the acute care settings. And of course, as a public health nurse, that's been my lens for I've only worked in public health settings in communities. And so what I've been seeing is the direct effects on people's homes or the conditions where they live, learn, work, and play, or are being raised or going to school. And so as a public health nurse, that's our health lens. And so we're working on the population health from that side. But Healthcare Without Harm was actually started by Charlotte Brody, who you might know, who is one of the founding members of the Alliance of Nurses for Healthy Environments, and actually did a self-study of all of the toxic chemicals that were in her body from working in hospital systems, right, and healthcare. And then through that study, she started with others, with another physician activist, Healthcare Without Harm, which is now international, and really strongly is working to advocate that practice-based care in healthcare settings where there's so much waste. And what they did is they looked at their mercury thermometers, or the mercury, right? And they're saying like, well, all our patients from this local hospital health system are coming in sick, but we're actually the heaviest polluters of this. So why are we doing this? Why aren't we looking at our own practices? And so that's how Healthcare Without Harm got started. But right now, their big focus is on carbon emissions from healthcare settings, which we know contributes to 10% of global emissions is from healthcare settings alone. So yes, Healthcare Without Harm is really a core member of the Planetary Health Alliance to try to educate health professionals worldwide. I will say, I know it's a huge problem. It's really easy to it's difficult, I should say, to keep at it and maintain the work and the hope, because it is exhausting. And I don't always have these great days. Like when I get to talk to all of you, it gives me hope. You keep me going. And also when I present to students, and when I'm hearing, when I came to 2018, the students were hungry for the information on climate change. They said, they're the first generation to grow up with it. They haven't known anything different other than climate change. They were saying, we were wondering when we were going to talk about this in nursing school. And now at our local UW Health hospital system, the sustainability coordinators, who I bring the sustainability coordinators from our local hospital and health systems into class, so the students know them and they can hear about what nurses can do to engage in especially the waste stream issues that you were talking about as well. And my students are searching them out now and engaging in ways that they never have before. So that's what keeps me going, but it is sort of like, how can we grow this faster, right? But thank you. Really important comments.
Yeah, thank you very much, Jessica and Sister Lucy. We have a couple more questions, but with the interest of time, I would just like to have Rose step us into our final prayer and plug for next month, and then we'll come back to a few more questions.
Yeah, I'm happy to hang out for as long as you need.
Yes, thank you, Jessica, for that incredibly interesting information and lots of energy around that. So thank you for that. So we close now as we think about sustainability and our care for the earth with this prayer that's based on Pope Francis Laudato Si, called A Prayer for Our Earth. All-powerful God, you are present in the whole universe and in the smallest of your creatures. You embrace with your tenderness all that exists. Pour out upon us the power of your love, that we may protect life and beauty. Fill us with peace, that we may live as brothers and sisters, harming no one. O God of the poor, help us to rescue the abandoned and forgotten of this earth, so precious in your eyes. Bring healing to our lives, that we may protect the world and not prey on it, that we may sow beauty, not pollution and destruction. Touch the hearts of those who look only for gain at the expense of the poor and the earth. Teach us to discover the worth of each thing, to be filled with awe and the contemplation, to recognize that we are profoundly united with every creature as we journey towards your infinite light. Thank you for being with us each day. Encourage us, we pray, in our struggle for justice, love, and peace. Amen. And we invite you to join us again next month on the 10th of August. Our speaker will be Carl Green. He is a community development educator with the University of Wisconsin Division of Extension. And he'll be talking about understanding La Crosse's water resources. And I understand the larger context of that is the Mississippi watershed. Is that right, Beth? And so we'll meet again that day at noon here on Zoom. And we hope to see you then. Have a wonderful July until August.
Thank you. Jessica said that she could stay with us for a few more questions. So here is the first one. What is the best way for us to address this on a local level. And this is coming from a sister that's based in La Crosse. And I would also add that FSPA in La Crosse has traditionally been connected with local healthcare across one street and Viterbo across the other. So what's something that they can do to address this at the local level with the Planetary Health?
Yeah, thanks for that. Well, first of all, I like to look internally at my own group and my own profession. So like I shared, and so what is being done, you just highlighted also some work that may be happening already in La Crosse. So look to find some work that's already being done that can be plugged into. But also I think it's important to look to see if there's any existing policies or advocacy work being done for climate action planning locally or around other sustainability issues that you can come and bring your unique lens to help inform that. So one thing that I did when I was able to leave government is I joined our Sustainable Madison Committee, which is a citizen group that informs sustainability policy and resolutions and so on for our Common Council. And I would assume that there's similar things or similar citizen groups that really need a wide range of lenses and expertise to come to the table to help inform policy in that way. So not knowing all the different resources there, that's sort of where I might get started, is to see again, what partnerships can you tap into that are already there, or what partnerships for people working on issues might you like to join, and then what opportunities are there to inform policy.
That's great. Thank you, Jessica. As someone that is trying to be connected with local here, the city of La Crosse is working on a climate action plan. And then La Crosse County is also working on their comprehensive plan. And funny enough, there's a meeting next week with the county with farmland preservation, but I'm going to be curious now to find out who might be looking at that bigger picture. So Thank you.
And I think I just wanted to add that too, just hearing your messages around interconnectedness, that narrative shift isn't happening in all conversations. I'll just say that. Like, I haven't heard that from other groups commonly. There's really the strong belief that humans are separate from nature and we need to learn how to connect without recognizing we already are nature, we're already one within it, and everything is interconnected, which is why we're feeling all the pain and why we need to engage so deeply. So I would really look to bring that unique lens into the conversation, and not from this like fluffy, oh, we're all one and we should all, it's really like, it's based in science. This is real. And this is where, the interfaith perspective and physics are aligned, right? So anyways, I just wanted to lift that up because it's a really important message, I think.
You're right. Thank you. Another question is from a guest here saying, we do elder care as our ministry. What can we do?
Yeah, so I said a few times that that our elders are some of the most physically vulnerable to some of the, especially the climate changes that we're seeing. And it depends on where you are. In Wisconsin, as I've mentioned, we're becoming warmer and wetter with more floods, extreme weather events. And so my first question is, does your organization have your own climate action plan? Are you looking internally at how you can adapt or mitigate? Yeah, go ahead.
We don't, and we're in Cook County, southern Cook County, along the Des Plaines River, south of Chicago, kind of at the intersection of I-55 and 355, those big interstates. Okay. And we've had all that flooding, the mosquitoes and everything. We're in Tornado Alley as well, that extends through Plainfield. And we just had a tornado horn put up by our city of Lamont. We're in that suburb of Lamont along the canals. And so the tornado things are going off more often in that, but we're not in nursing as such, although we do have a nursing element in our skilled care.
Right.
You
A number of cities and states were funded a few years ago from the CDC through their climate and health program. And so I think Illinois is included in that, in the funding. And if so, you might be able to connect with someone from the state health department to help inform your own climate action planning if you're interested in that, because they will be able to provide you then all of the data that you need, and then help you think through recommendations and action planning with that too. So, but yeah, it's really important to have a climate action safety plan, but then also look at your internal practices, as we were saying earlier, and what can you do internally to help mitigate, our own waste streams that are perpetuating some of this environmental degradation that we're talking about too. So.
it's a lot of the attends and poise and that, the incontinence issue really fires up a lot of what's going into the waste.
Right.
I really don't know do you have any idea about?
Well, that's part of the thing too, is that this is why only focusing on individual behavior change is tricky. If the solutions are that the corporations and the producers of these products aren't making, then we need to go farther upstream and start demanding that they make these products, right? We need to start advocating there. As consumers, we need to start advocating, and I'm sure it's happening. And you might even look into Healthcare Without Harm and their whole waste program and see, who's advocating for some of the same things that you're hoping to see of these, national, international corporations that produce the supplies for healthcare systems. And if the healthy choice isn't the easy choice, that's a problem, right? The healthy choice should be easy. And if it's not, then we need to start really holding the big corporations accountable that are making all these products that are not good for the planet.
Thank you.
Yeah, thank you, Jessica. Last month we had a UWL graduate talk to us just about Advocacy 101. So this ties in. My question for you is regarding from the public health perspective and with social justice interests, especially around here, not just with FSPA, what conversations can we have with those executive directors that are serving with folks in the community that are impacted? Because I feel like their eyes might just start rolling if I say something about climate justice. Maybe not, but what kind of conversations could we have if we're doing financial support or putting people on the ground to help with, let's say, sandbagging or that real connection with the other nonprofit that might be working to support those vulnerable populations?
So you're talking about working with like a social justice organization that is already on the ground and how you can further support their work?
Yes.
Yeah. So really just saying that, because you might be surprised that, again, a lot of the environmental justice and social justice movements are the leaders in what we're, now calling planetary health, but they're already seeing all of the links. And just to say, I'm concerned about the health effects of these communities. It's great that we're sandbagging the homes, but, I understand that there's a lot of drivers that you're working on in your social justice work that also fuel climate change. And, in that way, I'd love to support the work that you're already doing. And how do you see these things as connected? And what are your concerns about? So just, I think, asking more questions of them than coming to them with thinking that you have the answers, which we don't, because they're the ones that are most affected and have that on the ground support. So again, I think coming to communities or organizations that represent those communities, or that organizations that are already working with those communities on multiple issues, whether it's housing or transportation or education or all the different things, is coming to them and say, how are you defining this problem? What do you see as potential actions of how we can support? And really following their own intrinsic leadership and guidance with that too, because climate change is really a really downstream symptom of all of the upstream issues around racial justice and equity that so many organizations are working on already. So
that's good. You just gave me a brain pop there. That was really good. Any other questions for Jessica this afternoon?
I last month I said the same, I sent this comment in the email and you said you would forward it on to the student. Something keeps popping through my mind that Greta recently put out a video that really all of the little things that individuals do are not going to solve the overall big problem. It's the big corporations and the laws that govern them that have to change, because it's the big polluters, just the few wealthiest people that are sitting on top of the largest polluting companies that have to change. And so all of our efforts, are basically, getting people to recycle is basically just teaching people awareness so that they'll vote climate. And I was just wondering what your, it's basically voting, well, educating people so they vote, so the laws are changed so that the big polluters are forced by law. And I was just wondering what your thought is on that.
Yeah, 100%. I agree. It's not that we should stop our recycling. And the reality is that the recycling station centers are chock full of recycled material that they can't even ship overseas because no one wants. So like there's a lot of backlog to all the individual behaviors that we're trying to do and all the change. I still have solar panels. I still drive an electric. I'm still going to do the things, but I also recognize that I'm privileged to do that. And those healthy choices are not easy for everyone, right? So how can we hold all of these corporations, everyone accountable to make the changes that need to happen? How do we protect voter rights? And voter registration is a public health issue, and it is something that we look at and advocate for as public health nurses when we're thinking about planetary health issues and climate change and so on. And so there's this great book that I just started reading called All We Can Save. It's a 2020 collection of essays and poetry edited by Ayanna Elizabeth Johnson and Catherine Wilkinson that I highly recommend. And they talk about how we need all hands on deck. So we need all the individual behavior choice things that we can do, all the people working on that, as well as all the people that are working to hold accountable, as you were saying, the corporations, the agribusiness that I mentioned earlier too, that we're not gonna, you're absolutely right, without this huge power movement for a just transition, we're not gonna see the changes that we need to see fast enough. So thank you for stating that as well. Yeah.
Thank you, Kathy. All right, Sister Lucy, last piece.
Well, I have to kind of disagree. I'm looking at, all of us are invited to be involved in the Laudato Si action platform. And it's kind of interesting because while systemic change requires the level of involvement that I think it's Kathy was talking about, in order to get systemic change to happen, it usually starts with about 3% at the grassroots causing change. And it is you only get systemic change when you get between 20 and 25%. Some people talk about 13% is where the critical mass is to generate the change. And while I firmly believe that we need systemic change in order to make the global situation livable in the near future for humans, I do not believe we will get to it unless we do have the individual efforts and that coalesces into that mass that can generate the critical change. And as far as corporations, yes, they're running the world, but we are running the corporations by every dollar we spend and every choice we make in life. Every time you buy non-local generated food or non-local developed resources or anything made from new extracted resources, you are contributing and supporting what the global corporations are all about. The capitalistic society and economics and an extraction view, which you were talking about as humans are not a part, but we're above and we run. And so it's really examine your own heart and be a part of the critical mass to get change to happen. And you work on all levels is what I found.
Yeah, that's absolutely right. It takes everyone at all levels, from the individual all the way to the policies.
Yep. Well, Jessica, thank you very much for your time on behalf of the Eco-Spirituality Committee. It's been a great interest and joy to have you here and learn more from you. So your students are lucky to have you.
Thank you so much for having me. It's a great conversation. I'm excited for all of your work and everything you're doing too. So thank you.
We'll definitely stay in touch. All right. Thank you, everyone. Hopefully we'll see you in August, and stay cool and hydrated and take care. Okay. Bye.
Thanks. Bye.